Anna. So there is a slight rearrangement in the schedule. We'll be moving on to the next topic by Dr. Thomas and Vargese, that is all about spectacles. Over to you, sir.
Good morning, everyone. At the outset, I'd like to thank Dr. Anjana, Dr. Sanitha, and KSOS for this opportunity. This is a topic that we don't really speak much about. We leave it to the opticians. But I think increasingly, this is something that we need to look into, because very often, if the patient is unhappy, they come back to us. So all about spectacles, whatever I can in 9 minutes. So of course, certain things that we have to play an important role is a detailed history and symptoms. The occupation of the patient, their working distance, I think they're extremely important, and we should make sure of that before we're giving our prescription, and the range of clear vision that they would like to have. IPD, these fancy gadgets are there to measure IPD now, and of course, for any prescription beyond 5 diopters, +5 or -5, it is important to record the back vertex distance. And make sure when you write the cylinder, it is the same power in both, same sign in both eyes, and also the axis. So selection of frames, really patients are now spoiled for choice for the selection of frames and lenses. Most important things, of course, comfort and fit of the specs, frame material, lens compatibility, durability and flexibility, aesthetic appeal. Increasingly, our patients are all very concerned and pay a lot of attention to the aesthetic appeal, adjustability and maintenance, and environmental resistance. Some frames, some materials, as you know, can get damaged by sweat and other water. And you know, during the COVID epidemic, a lot of people had problems because of sanitizer use as well. So some things that we can pay attention to, and some probably you can just advise the patient as well. But finally, of course, it is their own decision. The style, the personality, face, the shape of the face, the size of the face, all these are important. Nose features, skin and hair color, and type of lenses. And I'll go through this briefly. This picture on the right that you can see is a radio jockey, Nina, whose videos are viral about the new WhatsApp fraud which is coming up, where your WhatsApp account can be hacked. And you can see her fancy glasses. I don't think we can actually wear this to work. So a lot of it depends on the profession and what the patients do. So the professional look versus the casual look. And this center picture you can see is the lady in a new movie, and you can see a really fancy glasses there. So the face shape, what they say is that ideally your frame should complement your face. So if you have a round face and you don't want people to focus too much on that, you can use a slightly square or rectangle frame. And so based on the different face shape, and a lens can be chosen which can sort of complement your face. And I'll show you an example here. So lady on the left, she's got a nice round face, and her glasses are also quite round, while the lady on the right, very similar looking glasses, but she's got a very oval face. So it sort of balances out with the face shape as well. The comfort and fit of the spectacles, you can see different parts. The bridge is very important, and the temple length, that is the leg of the frame, that is what is very important. And of course, you want to use a light material and which is strong as well, like titanium or acetate. The nose, very important. Some people, well, majority of people actually a slight bend in the nose, and so some frames just do not sit. The different types of bridges are the keyhole bridge, the saddle bridge, and sometimes if it's a marked deviation in the nose, then ideally you should have a frame with a nose pad which can be adjusted to balance the problem. The width of the frame shouldn't be too wide. Then you have the legs sort of splaying out, or it shouldn't be too narrow. It should be just right, the size of the frame. And patients who are already using spectacles, if you look at these numbers on the frame, they're quite happy with those spectacles and just going for a new one or a power change, then you can look at these numbers on the frame, which will actually tell you the width of the frame. So the two lenses width plus the distance between the lenses, that will give you the width of the frame. And so if they're happy with a particular frame, they can go for the same size frame. Some people also suggested based on the skin tone, you can use different lenses, but finally, as I said, it's a personal decision. So if it's a warm tone skin, go for a gold or brown frame, as opposed to a light, cool tone skin, you go for a silver or blue frame. There's these new gadgets now. We take a photograph, it's called an optic cam pad, and we just take a photograph and gives all these measurements. So monocular PD, the segment height, pantoscopic tilt, vertex distance, all these can be taken just with the photograph. You can get all these measurements, so it really saves a lot of time. Frame material I already emphasized. So light, strong material, titanium, stainless steel, acetate, and people with tendency for allergy, you can use hypoallergenic materials like titanium, again stainless steel, and high quality plastics. The lens prescription, you have to match with the frame size. So if it's a high prescription, go for a slightly smaller size frame, otherwise the lens will be too bulky, or otherwise of course you can go for a high index lens. And multifocal lenses, some people for style reasons they go for a very narrow, vertically narrow frame, but then the area you have for the different powers is very much reduced, and they can be very symptomatic. So a progressive, you need to have a minimum height so that it gives adequate area for the different powers. Frame selection, this is something I often have a difficulty with, because when I go to buy new glasses and I try on the new frame, I can't actually see myself in the mirror because my power is -4. So now I bring the mirror really close up to see how I look with the frame. But nowadays you have these gadgets, we take photos and show you the wearing with the different lenses, different spectacles and frames, and then you can see how it looks. This is an article my daughter showed me this morning in a very popular magazine, Grahalakshmi. You can see written by Dr. Chandrakant. It just shows how much importance parents give to spectacles worn by their children. So this, now I'm just going to briefly talk about children's spectacles. So dispensing lenses, you can see there's so many beautiful frames that are now available. This is a photograph of me in 7th standard. You can see I had this thick frame because I was a hyperactive kid, and my parents were very worried that I would break the frame. And my first time I started wearing in 5th standard, and in 6 months I broke 3 frames. So you can see the importance is that the child should be happy with the looks and also the comfort, otherwise they're really just not going to wear it. And the bridge, they say, is that the bridge should ideally be at the middle level, so that it is not, because the nose is still developing. So nowadays you have these beautiful frames, very flexible. The child cannot break it even if the child wants to. And also if you want, you can add this strap at the back so that it doesn't slip off. And also at the back you can have, you have this what is called the riding bow, so that the lens spectacles doesn't slip off from the face. Briefly on the various types of lenses. Again, for children, you have ideal lenses are the CR39, poly, MR, and definitely no glass lenses. So here again, you're worried about clarity, lightweight, and good optics. And lens selection, as I said, if it's a high power lens, go for a high index lenses, or else you can go for a slightly smaller size frame. Briefly on the progressives, you can see different new progressives that are now coming out, which are much wider area of clear vision. So these are the conventional progressive addition lenses. Then you have the freeform progressive addition lenses, which gives a much wider area. And now, of course, don't forget the online revolution. And I was just trying this out. This is from Lenskart. It takes your photograph, and then you can try on the different frames and how you look with the different frames. And increasingly, especially our youngsters, are going for online purchase. And of course, if they have a problem, they're going to come back to you. And when you get the spectacle, the patient always asks, Doctor, Kannada vaanchenya kondu vandu kaanikano? You just say yes. And then what you can do is, what is this known as the 4-point touch method, where you just put the specs upside down and make sure the 4 points are touching. That means the alignment is correct. And quick adaptation tips. So obviously tell the patient, don't keep switching with your old spectacles and new spectacles. Stick to this for a good few days and use them as the primary pair. And of course, in the case of progressive, just tell them it's going to take 1-2 weeks to get adjusted. Thank you. And that's me in 10th standard, slightly smaller frame. Thank you.
Thank you so much, sir. That was a very elaborate, yet concise presentation, and with your personal touch, it made it more fun. Thank you.